will be speaking about her role and the role of her office and what is happening in the province of British Columbia. Thank you, and Cory, please.
Can you hear me? Thank you, Miriam. It's a pleasure to be here today. I know you've had an extremely busy morning and you have a busy afternoon, and I wanted to thank you for hanging around at lunchtime while Sobhana and I talk about the Provincial Office of Domestic Violence. I wanted to introduce Sobhana Daniel, who is beside me here and will be navigating the PowerPoint. We'll see how well we do. We've done this PowerPoint a couple of times, different versions, and sometimes it's worked, sometimes it hasn't. So please bear with us if we have any issues, but we'll also have copies available after the presentation. I also wanted to say, I know it's your lunch break and it's just after 12 o'clock. I'll try not to speak too quickly to get everything in. But please feel free, if you do need to stand up or get more food, please feel free to move around. As well, I'm hoping that I'll finish a little bit early so that you have time for a couple of questions, and then possibly you can just get out of the room for a few minutes before this afternoon. Today, what I thought of where we would start is talking just generally about the Provincial Office of Domestic Violence. And the key goal today is to provide you with an overview of our office and the work that we're undertaking. And in particular, 3 pieces of work that have been a priority for us over the past few months. One piece of work is the identification and mapping of government services and government-funded services across British Columbia. I'll also talk about the Taking Action on Domestic Violence Action Plan in response to the representative's report on honoring Caitlin, Max, and Corden. And then Sobhana and I both will spend some time talking to you about the development of a comprehensive provincial 3-year domestic violence plan for British Columbia. On March 1st, 2012, as an immediate response to the findings and the recommendations in the representative's report that I just mentioned, government announced that a new Provincial Office of Domestic Violence would be established, and that office came into effect on March 26, 2012. As you probably saw from the first slide, prior to coming back to government, I had worked for the Representative for Children and Youth for the past 5 years and had been the lead investigator in the most recent report. Our office is a permanent office, and while we're situated in the Ministry of Children and Family Development, our goal is to ensure coordination and accountability on domestic violence across all of the government systems. So I know today, and in particularly this morning, you've heard a lot about the justice system. And as you know, when we're addressing or responding to domestic violence in British Columbia, there's a number of systems that come into play, such as the Child and Family Serving System, the education, social development, health, justice, and we need to ensure that there's coordination at the provincial and community level and how we respond and address domestic violence across all of those systems. We are a relatively small team. There are 8 staff, and we come from all sectors come from the various sectors. My background is in child welfare. We have staff that come from justice, from the community, from First Nations communities. Our mandate is a permanent lead for government on strengthening the services and supports available for children, families, women, and anybody that is affected by domestic violence. We're also responsible for ensuring that all of the provincial policies regarding domestic violence and the programs and services are delivered in a coordinated manner. And our other responsibility, which is critical, is monitoring, evaluating, and regularly reporting out on the responsiveness of the programs and services. And I think it's very important that when our office was established, it was permanent. In 2010, there was a domestic violence action plan in British Columbia in response to honoring Christian Lee, the representative's report, as well as the inquest into the deaths of Christian Lee and his family. And government took a number of positive steps during that time. And the plan lasted 10 months, it was implemented, and it was closed as implemented. That doesn't mean everything ended at that point. There was still a lot of good work and a lot of positive work moving forward. When the most recent representative's report came out on March 1st, government acknowledged that more needed to be done, and we needed to look at domestic violence and how we respond to it in this province systemically. And that this new office would show the permanent leadership and work across all of government with respect to that. The other piece I wanted to share is that while we're situated in MCFD, we don't have responsibility for service delivery the legal mandate of any of the justice programs, child welfare programs, health programs. All of those programs are mandated through the various ministries, and the service and programs remain through those ministries. Our work is to sit down and work very closely across all of those ministries, across all of the various levels of leadership, to ensure as we're moving those agendas forward and the work we're doing is coordinated. The work of our office is based on a number of key principles that I'm sure you're all familiar with, that safety is paramount, safety of our communities, of children and women. Prevention is essential, that services are adequate and they're responsive, and that responding to domestic violence requires a coordinated and holistic approach. Our office is committed to listening to the voices of those who have been impacted by domestic violence and demonstrating inclusivity, collaboration, and respect. One of the first things we had to do when our office was established is actually create awareness. Because we were a brand new office, what is our mandate, what is our responsibility? How do we get out across British Columbia and engage with professionals and experts such as yourselves in the room today and others across all of British Columbia? To date, we've engaged with a number of provincial and local organizations, groups, and committees. We've presented at meetings and at conferences and at training events, and we're starting to build strong relationships and partnerships across all of the sectors. I actually said to Belbeer when I came this morning that Belbeer contacted me before the office was even established and before I was even appointed. So we've had an ongoing early relationship, and we look forward to a continued relationship. And at the end there, it mentions we're accessible by phone, email, and on the internet. And I'll talk a bit more about that at the end, as well as leave you with some information on how you can contact our office. We've been engaging and consulting with government and community stakeholders and partners, and we know that that's critical to our work. We also work in collaboration, as I mentioned, across the sectors with a number of provincial ministries, crown corporations, law enforcement agencies, anti-violence professionals, and others, as you can see. And our current priorities are engagement and consultation, and we're going to speak a bit more about that when we talk about developing the 3-year plan for British Columbia. Our other priorities are around system service coordination. So we know that that's going to take some time to do across government, but we also know we need to start now, and we're working towards that. And many of the services and programs and actions coming out of the plan that I'll talk about shortly demonstrate a coordinated approach. We're looking at training, revising and or developing core training materials. One thing that I've experienced and I've seen since I've taken over this position is there's a lot of training across the various sectors, whether it's in the government, whether it's in the communities, whether it's anti-violence professionals or it's in the academia, that we need to look at and build on. So if there's core training that can be available across the community sectors and the government sectors, then that's something we need to look at and recognize that that training may be appropriate for various service providers. We're also looking at information sharing and supporting that across government. So what is health doing? What is justice doing? How do we share that information across government? And for the most part, we do know what we're doing. It's just the detail and ensuring we're working together as we're doing various initiatives within our ministries. And then, as I mentioned, the monitoring. And one of our key roles around monitoring at this point is monitoring the action plan that is developed, and that I'll talk about shortly. So as I mentioned at the beginning, there's 3 key deliverables for our office. One has been the extensive and in-depth identification and mapping of the government services. The second has been the completion of an action plan in response to the representative's report. And the third is the development of the comprehensive plan. I'm just going to speak a little bit about the identification and mapping. And I know I've been asked in the past, well, like, really, how long can this take? Like, you know what's out there, go to every website in government and look at, what's happening. What is the policy? What is the legislation? And obviously that's where we started, but we also are working closely with all the ministries that deliver or have accountability for domestic violence programs and services, training, policy. And we're really looking at it in an in-depth way. And we're drilling it down to what does this look like at the provincial level, but more importantly, what does this look like at the community level? So if these are the provincial policies, how are they working at the community level? So what we've worked, and the key ministries that we've worked with, I should just mention quickly, are Aboriginal Relations and Reconciliation, Children and Family Development, Education, Health, Jobs, Tourism, Skills Training, Justice and Social Development, and the Crown Corporation's BC Housing and WorkSafe BC. So all of these government ministries and Crown corporations either deliver programs, have responsibility or accountability for a number of various programs. Government also provides annual funding for services to support victims of crime and for women and children fleeing violence. And many of you are familiar, obviously, with those programs, or may even be running those programs or providing support in those programs, such as the Victim Services Programs, the Violence Against Women Programs, Crime Assistance Programs, and the Transition House Services Programs. So our identification and mapping exercise is taken, what are the programs and services? So we're looking at transition houses, safe homes, stopping the violence counseling. Where are those actually located throughout the province? So we're mapping that across 47 service delivery areas of the province. So we'll get a really good sense in each area of the province, what is the community profile? So are there courthouses, are there probation officers, the schools, are there MCFD offices, social development offices, what are their catchment areas? And then what is the domestic violence response in that particular community? Is there a domestic violence unit, such as there is on the Lower Mainland in Victoria? Is there a VAUR committee, a Violence Against Women and Relations committee, or a community coordination committee? And then we take that one step further and look at what are all the programs. Is there a Stopping the Violence program? Is there an outreach program? What are all the various programs that are in that community? We're not at the place where we're saying, this is Victoria Transition House and it's on this street. We'd obviously never say that. But it's really just identifying, do these services and programs exist in these various communities? The report that we're doing is actually done. It's being desktop, and we're going through a process right now of just checking our facts and working across government to make sure that it's accurate. We see it as a document that is a living document that we will update regularly, and it will be available shortly on our website. And I'll talk to it more soon, but we'll also be using this document as one of our tools while we're developing the 3-year plan, as potentially we can look at this document, and at least I can look at it now and see quite clearly where some of the gaps are. So as we're building consistency around this province and in how we approach and address domestic violence, this will be one tool that supports the development of the comprehensive plan by potentially identifying gaps that we can analyze further. So the second deliverable that I mentioned is the Taking Action on Domestic Violence in British Columbia plan. We brought some today. This is a plan that was developed and was one of our key deliverables when I first took on this position, of responding to the 8 recommendations that were in the representative's report. So I'm not sure if you're familiar with that report, but if you haven't read it, it does outline the chronology of the circumstances for Caitlin Max and Ford and Shorenborn and their family over a number of years. And the findings are really looking at how did the system support that family and those children, but also did the workers that were involved have the necessary tools, the necessary supervision? What types of services and supports were available to the workers that were supporting that family? The 8 recommendations that come out of that report are specific to the findings. So what you'll find in this report, we call it Taking Action on Domestic Violence in British Columbia, but it's really a response to the Caitlin Max and Corden report that sets the course towards a more coordinated approach in this province. So I just want to be clear when you read this, this isn't the Domestic Violence Action Plan, the 3-year that I've been talking about. You'll notice in the report itself, it outlines the response to the recommendations thematically. It doesn't say Rec 1, here's what we're doing, Rec 2. We tried to break that down and look at specific themes. If you're interested in each of the 8 recs, which I am going to talk about now, they are in the appendix at the back of the report, and you can see what the response is to each of those 8 recommendations. So this report was finalized this past September. Can't believe it's November. It feels like it was just completed yesterday, but it was completed in September and it was released on October 10th of this past, I guess last month now. I was going to say this past month, but today's November 1st. which I was reminded this morning, it's my daughter's birthday today. So the first thing I got up this morning, she's like, you can't leave, you have to bake goodies for school. And obviously I wasn't able to do that, but it did remind me that it is November 1st and time does move quickly. So this report was released on October 10th publicly. It responds to the 8 recommendations, as I mentioned, and it was developed between April and July of this past year. It was developed by a group of staff, senior staff members across the ministries that I mentioned earlier, and really looking at, we sat down and we went back and we worked amongst our teams on how are we going to respond to these recommendations? What does this look like? How do we set the tone for a coordinated response and approach across this province? The plan was due to the representative, so it was due to Mary Ellen Trepelafon by July 31st. We decided to present it to her earlier, so she received it in early July so that she was able to review the draft and provide her input and feedback, which we could then consider and incorporate. And I was pleased to say that most of the feedback was incorporated. So in addition to responding to the report, as I've mentioned, when you start to read it, it sets out the course about where we're going in British Columbia as a province, and the plan that we are developing, and how we are going to enhance and strengthen the services and supports that are in place. And it does commit to the development in that plan of the 3-year plan. So you may have heard some folks say this is a plan about a plan. And in some ways, it is a plan that does talk about a bigger plan. But I think it's really important to keep in mind that there was 3 months to respond to these recommendations, and we know that we need more time to put together a comprehensive plan for this province. But I do want to say that, and it's my strong belief, that we don't need years and years and years to put together a 3-year plan. And I've heard during my many years at the RCY, and since I've come back to government, that we know what needs to be done. We just need to take the action. And so that's part of our philosophy in our office, but we also feel that we need to look at all the reports that have been done, the inquest, all the recommendations over the last number of years, including the report that was put out recently, last April now, by the Anti-Violence Association, the 33 years of recs, and look at where are those gaps? Are those themes still relevant? How do we move this forward? So I will talk about it as I mentioned, but our goal is to have the plan ready for implementation in 2013. We're just going to go through now, and I'm cognizant of time, so if I start to talk too fast, just tell me to slow down. We're just going to go through now the recommendations so that you can start to understand some of the steps that are being taken as we speak and over the past couple months, and more of the shorter term, longer term actions in response to the plan. You'll notice in the responses, many of them are around enhancing, revising policies, or around training, around considering legislative amendments, and that is because those are how the recommendations were put forward to government. The report made 2 systemic recommendations, and the first was to change in this province, in our health system, how we look and we respond to families that may be experiencing untreated mental illness, substance abuse that's problematic, or domestic violence, and taking steps to ensure that all staff and professionals connected to those systems, so the health system as well as the child and youth system and MCF, child and youth mental health system and MCFD, understand the risk factors relating to children and parents who have serious untreated mental health, domestic violence, or problematic substance abuse. This recommendation was made because there was concern that with the father's untreated mental health, it was never looked at what does this mean for the family and what does this mean for the children, and have appropriate referrals and support services being put in place to support that family to actually make change. In response to this recommendation, sorry for all the lines, I know from my education days I would get in trouble for having a PowerPoint with this many bullets on it, so don't grade me, Valbeer, on this one. But what is happening at this time is that tools and protocols for information sharing, for referral processes within both of these systems, within the health system, the health authorities, as well as MCFD, are being developed. There's been literature reviews done that are being developed to identify and support families when risk factors relating to children of parents with the conditions that I mentioned are identified. So that work is being undergone in the last couple of months, and very shortly we'll be able to identify within BC 2 communities One is rural and one is urban, where we'll actually, these have been chosen as the prototype locations, where we'll pilot these tools and work really closely with our community partners around us. So I do want to say this isn't government coming in with health professionals or with child welfare or child and youth mental health saying, we're developing these tools, we're going to implement across these systems. This is working with our community partners on what does that look like. And you'll see when the announcement is made shortly that the communities where this has been chosen, where these prototype locations have been chosen, are working with really closely with the anti-violence professionals, the folks that respond to domestic violence in those communities to ensure that there's adequacy in the development and they're consistent around the tools, how they're developed, how the information sharing protocols are developed, that relationships can begin to be established, as well as looking at is there an adequacy of services. Because if we do start looking at a different approach in our healthcare system and looking at being more family-oriented and knowing where the services are and making those referrals, are there adequate services? So that's something we'll be looking at as well. That recommendation is going to be implemented in 3 phases. So I just mentioned the pilots, which will, the development of the tools and the processes are being completed now, and the pilots will start in January. By next October, they're going to pilot the protocols. They'll look at the pilots that are being done now, they'll do an evaluation and revise accordingly, and then starting next October, so just over a year, they'll look at across the province at 20 communities, and they'll look across the various health authorities at piloting in urban and rural within each of those communities. So it'll be close to 20 communities. And then by January 2014, which really in the big picture isn't that far away, this will be in effect across the province. The second systemic recommendation, I'm not going to spend much time on because that was really the creation of the office and the work that I told you that our office is undertaking. But this was really around government taking steps to demonstrate a serious commitment to protect children exposed to and living with domestic violence. This was a recommendation made in honoring Christian Lee, and as I mentioned, there was some good work done, but the representative felt that it didn't go far enough and it needed to be sustained with permanent leadership. There's some key points the representative made in that recommendation around adequate funding, appointment of a permanent lead, and also around continuous evaluation and reporting. One of the concerns was there's a lot of good work and a lot of good collaboration and coordination that goes into policy development, social policy, public policy, but what about implementation? Who monitors the implementation? Is it adequately resourced? Is it making a difference? What are the outcomes? Are we achieving those outcomes? That will be one of the key roles of our office, and that was one of the recommendations from the representative as well. So we'll skip the next slide. The following 5 recommendations were specific to ministries. So we took the lead on working with the ministries around these recommendations, and we all came together as various ministries and discussed how we were going to approach this and what our actions would be. Again, this was a recommendation made in honoring Christian Lee that proposed required changes to legislation and develop policy standards and training to provide social workers and specifically working in child protection with clear direction in assessing the safety of children who are exposed to domestic violence. In British Columbia and in child welfare, while there had been good public policy documents developed with best practices approaches in 2004, the implementation that followed wasn't clearly planned and there was no training. So that was a real concern that when the representative had completed an investigation in 2009 and then the next one, where was this at? So that's an area that the ministry acknowledged that we need to do more on. The other recommendation was, and this is quite controversial as well, was around changing the child welfare legislation. So when you're looking at circumstances where a child may need protection, how do you look at circumstances where children are living with families experiencing domestic violence? I know going back a decade, that's raised a lot of controversy. The representative clearly felt this isn't about every child that shows up with a parent at transition house needs to be reported to child welfare. That wasn't the intent of this recommendation at all. But what was clearly heard from social workers was, how does the legislation guide us in assessing circumstances of domestic violence? And this is really important. If you're familiar with the Canadian Incident Study from 2008, 34% of the substantiated child maltreatment investigation, exposure to domestic violence is a key factor. That's more than physical abuse. So that's quite significant. So how do social workers look at that? And do they have the tools and support? So again, it wasn't about blaming, it was more about are there adequate tools, supports, training, supervision in place. So government is considering the amendments to the Child and Family Service Act. And when I say considering, it's considering at this point, there obviously would have to be consultation with the anti-violence sector and the community partners, as well as the government partners. They've reviewed and updated their child protection and child and youth mental health policies. So child protection workers in this province now, there's in their policies, there's sections on intimate partner violence across any of the approaches they're taking and how they assess cases. They've developed and they're going to be implementing standards and policies for clinical supervision of child protection staff so that supervisors are very clear, and these are the expectations of you as a supervisor when you are supervising child protection workers. And the consequential amendments to the CF&CS order, CF&CSA making breaches of their protection orders a criminal offense will become effective and implemented on March 18th, so the same day as the new Family Law Act. The fourth recommendation was regarding developing and implementing a comprehensive plan to improve the capacity of social workers and child and youth mental health professionals to support children. And here the ministry really looked at establishing community support. So how do we better support our social workers throughout the various regions to ensure consistency of practice and to show leadership around consultation and coordination and training? So they've established in the ministry domestic violence leads in each of the 13 service delivery areas. And they're developing and implementing training for all MCF social workers and supervisors, as well as social workers and supervisors from delegated Aboriginal agencies. The focus initially will be on training any of those workers and supervisors that are involved in child protection work, and then they will also provide similar training to those who provide non-child protection type of delegated duties. The training will focus a lot on the dynamics, the complexities of domestic violence, but also on the legislative. How do you respond under the child welfare legislation? How does the legislation guide you? What is the policy? What does that look like? And then move towards, in the coming years, more around the coordination, because I think we need to, and I know there's work being done, looking across our service providers at how do we train around community coordination? How do you reach out to the partners in your community? And there are various avenues to do that in place now. So that's approximately 3,500 staff. And in the child and youth mental health side, they're developing specific training for child and youth mental health workers around trauma-focused cognitive behavioral therapy. And they're going to be including that in how they look at the impact of domestic violence on children and families. So there'll be training starting in the new year for child and youth mental health workers in the ministry system as well. The fifth recommendation, and I won't spend a lot of time on this one because I've talked about it a little bit, but was around supervisors and clinical supervision. So in Ministry of Children and Family, what is the training plan for supervision training? So we talked a bit about, we're looking at developing standards and what does that look like, but what about training? What about supporting social workers in those systems? Do they have the tools? And so the ministry is looking at developing and implementing a pre-appointment training program and a certification process for supervisors in MCFD as well as the delegated Aboriginal agencies. And that will roll out in the new year as well. And that is approximately 520 staff. And those 520 staff are also included in the 3,500 staff that I mentioned earlier. So there's a lot of training going on in the ministry, as you can see. There was a recommendation to the Ministry of Education to develop and implement a plan to improve the capacity of school personnel to support and protect children living in circumstances of domestic violence. And the education has taken a number of different approaches to this response. They're looking at delivering training on recognizing and responding to domestic violence. It will be a component of the erase bullying training that's going on over the next 5 years across the province, which at the end will be approximately 17,000 educators and community partners that will have taken that training. We're working with education on the curriculum and that training. What does that look like? They're establishing in each of the schools an index of community resources so that students know what the supports and resources are in their communities, and that would be for educators as well. And they're also looking at supporting community-based violence prevention programs in the school. So there are a couple of programs now that do go out to the schools. One's more around prevention, which is to be more than a bystander campaign where BC Lion football players go out to various schools. And the other is the Violence is Preventable program, where the Child Who Witnessed Abuse program workers go out and do work with school children and educators. But there's definitely a feeling we want to look at that in education and that more needs to be done there. The Ministry of Justice, I won't talk a lot about this recommendation and the response because you heard some of that this morning, but there was a recommendation in this report, as well as in honoring Christian Lee, that was pretty broad, to develop and implement a plan to improve legal processes related to domestic violence cases. This recommendation, there was work done on it in 2010 in the action plan, and it was actually quite timely that there were a number of justice initiatives underway during the time that we were responding to this report. So the new Family Law Act, as many of you are familiar with, will be implemented on March 18th. And it will promote a better response to family violence, it's intended to, and it will increase the ability of the courts to deal with family violence. Defines family violence, legislates the risk factors considered in parenting cases involving violence. The best interest of children is a key goal, safety of the children is a key goal in the best interest test. And as well, the new protection orders, breaches will be a criminal offense. So there's a lot of work being done around preparing the legal community, the anti-violence sector, the government community with resources for what does this look like on March 18th. We've been working closely with Justice and the Assistant Deputy Minister, Linda Kavanagh, was actually here today. We've been working very closely with Linda and Marcy Zaroba, who's here from Justice as well. So if you want to add anything or if I inaccurately say anything, let me know. But there's been a lot of work done around the implementation. We'll continue to monitor this when the Family Law Act is implemented. And that's something that we'll work really closely with Justice at. So have workers had adequate training? Do we need more training? What does this look like for women? What happens on March 18th? How are these orders enforced? How are police enforcing these orders? So there's a lot of work, as you can imagine. So I'm probably not giving it the justice that it deserves. But just given the short time period, I thought it was important to raise that. And then you also had Mr. Jeffrey Cowper here this morning talking about the criminal justice system for the 21st century, the report that was done. So as we were developing a response to this recommendation, this process was also underway. Government is reviewing the report and all of its recommendations, and was it just last week or the week before the first part of the white paper was released, which sets out the 10 separate actions necessary in this province to create a transparent system of justice. And I know he spoke a bit about that. And part 2 of the white paper will be released in the new year, and it will focus more on timely balanced justice and public safety operations, on better services to the public in various processes. So we're working very closely with the Justice Ministry and with Linda and Marcy at what does this look like, and we'll be involved, and what does this look like for families experiencing domestic violence. The representative in her reports feels very strongly that British Columbia needs to look at domestic violence courts. And we know in this province that at the grassroots level, some of those courts have occurred, such as what's happening in Duncan. So this is all something that we'll be looking at. The representative feels strongly about the domestic violence courts, but also feels like that's not for every community in BC. So we need to look at various approaches and strategies in different communities. So that's something that we're working on now and we'll continue to work on. So it was actually quite timely. The other actions that are mentioned, I've already mentioned the first 2, actually the first 3. So we can go to the next slide, is the Ministry of Justice is reviewing the telebail process. If you've had a chance to read the Caitlin Matson report, you know that that was a matter of concern in that report. And the review that's being done with Justice will inform a proposal with possible options for consideration. And that review will be done by the end of May next year. And also an enhanced ID system on the Justin computer system has been introduced, which helps identify files involving domestic violence and child victims. So in the past, you may have gone in and looked and seen that there's an assault charge. Now there's actually a flag and you can see it's an assault charge, but it's related to domestic violence. So it's more timely and proactive in helping Crown identify those cases. The training for, online training for 2,500 support workers and victim services, violence against women, and the transition house programs on domestic violence safety planning was implemented in June. Some of you may have been at the launch of that training or may have had the opportunity to take the training, so we encourage you to take it and definitely to give us feedback on how that's going. There's also going to be domestic violence training at the Crown Council Conference coming up later this month, and as well as some follow-up training for police officers on assessing risk and safety planning in domestic violence investigations. The last recommendation was made to social development, and there were real concerns around around how we support women who are fleeing violence and women who have children around the social assistance program. And I've been quite sort of pleasantly surprised when going out to some organizations and some in the Lower Mainland here, just at the grassroots level, to see, wow, there's great relationships and great work being done in some communities around this. But this is really around what is the plan of this program. Like, they need to have better ways of ensuring that their policies are complied with, because there are policies around women who are fleeing violence not having to work, but also ensuring that those women are supported. The Ministry of Social Development is currently updating and developing new policies regarding clients that are fleeing domestic violence, and they too are looking at domestic violence type of flag on their community computer systems. I know the flagging, screening can be quite controversial, and I've heard that loud and clear. And the purpose with this recommendation, when it was done by the representative, was how do we ensure these women and their children are receiving the supports and the policies are being followed. And that wasn't the case for the mother of these children. She was in her community looking for work, searching for work, and needed to hand that in. So that was really the intent. How do we ensure they're supported? If we're coordinating across the province, how do we ensure that everybody's working together to promote and ensure safety? At the same time I know that there's issues around confidentiality, around information sharing, but it's around better protection for children and women who are fleeing violence. They're also developing and implementing a case management role within existing field staff positions to make sure that domestic violence policy are applied and to act as a point of coordination. This is an action being taken in response to this report. You may also be familiar with the representative's report around a teen girl that was left with her deceased mother for a number of days, and there were concerns at that point as well, because the social development system is a caseless system. So this recommendation is really a point so that when women come in and they're fleeing violence, they have one point of contact. That may not be on the initial application form, but the flag will show for the person who's responsible in that area, in that system, who these women are, and they'll connect with them and make sure they have the necessary supports in place and the necessary referrals. And social development is also working with us around delivering training on domestic violence to their staff. So that's the Taking Action Plan. As I said, it looks like this. It's on our website, but we also have left some copies of it. Our next key piece of work on this really begins now, because the plan has come out. Some of the actions have started in April. The actions are short-term, immediate. So the immediate ones go up to this December. The short-term goes over the next year, and then long-term. And our role is to regularly monitor the implementation and report out. We have to report back to the representative by December 31st. When we met with her recently and talked about that, Christmas, we realized we're probably reporting out with all the holidays, the first week in December, so we're ready to do that. And we'll start reporting out publicly twice a year, starting in March of this year. So you will see all of that information on our website as well. So I've got about 10 more minutes, and we'll talk about the 3-year plan and hopefully have time for a couple of questions, and then go from there. So the 3-year plan that I've talked about, and I just put this slide up, but I know all of you know this, that an effective systemic approach to domestic violence across the sectors must include a focus on risk assessment, safety planning, coordination, collaboration, responsive and timely services, victim support, offender accountability, and support and information sharing. It's critical that the system that we build and the plan that we build in this province covers those areas. The plan that we're looking at building is going to be based on clearly defined outcomes. So what are we trying to achieve? If we don't know what we're trying to achieve, it's hard to get to where we're going. We're looking forward to this approach because the approach with the representatives report was we had recommendations, they were made, there were findings, it was clear what the issues were, and we responded. This will be a more holistic approach across all of government and with our community partners. But where do we see British Columbia being in 3 years? What are our outcomes? What are we working towards? It will be focused on prevention, on protection, safety, and on responsive and adequate services. The plan will be inclusive of a specific Aboriginal strategy. We have a manager of Aboriginal engagement partnerships who's currently working on that strategy across government and with the First Nations, Aboriginal and Métis communities and organizations and leaders. And it will also include specific approaches to support women, immigrant women, refugee women, non-status women, and women with disabilities. So we envision in this province having a plan, so not separate plans for everybody, but a plan that is inclusive of specific strategies as well as specific approaches. I know there was a question during Mr. Cowper's report, during Mr. Cowper's presentation, and we've really taken the holistic cultural view that we need to work across the communities and across all of the organizations to ensure that we have appropriate and supportive approaches to women and to support men that come from various cultural backgrounds, faith backgrounds, and that's what we are committed to looking at. The provincial plan will build on the Taking Action plan that I just discussed in those 8 recommendations. It will also build on the 2010 domestic violence plan that was released that I mentioned earlier. And it will also take into consideration all of the recommendations made from inquest, RCY reports. In 2010, the coroner had a domestic homicide panel. We're going to look at all of that, and that will be considered. And also the plan will be built on a lot of the good work being done in the communities today. So I really want to be clear when I say that there's a lot of success out there, and you know that, and you see that firsthand in the work that you do. And fortunately, I do hear about it. I don't hear about all of those successes, but I'm really eager to learn about what that looks like. And I know I was out recently in Surrey, in the Surrey Women's Centre, and some of the work that the initiatives going on there was really exciting. And were some of the things that we've been looking at. How do we do a better job in this area? So it's really important that we do look at what's happening in the communities. People have been working on this, experts, professionals, educated students like yourselves have been involved in this for a number of years. So we need to hear from you, we need to see, hear your voices, but we also need to learn from some of the work that is being done across the province. The mapping exercise will identify the strengths and gaps in the service delivery, as I mentioned. And as I guess I can't say strong enough, is around implementation. We'll need to make sure the implementation of this plan is very well done, clearly thought out, that it's monitored, that it's evaluated, that it's resourced. The resource is always a big question. And we will monitor the plan to ensure that we do achieve the outcomes that have been defined. The training needs across the sectors will also be a priority. And I know I mentioned at the onset of the conversation today that we're looking at training across all of the various sectors, but it definitely will be a priority. How do we build on that and work together? The plan will address the need for enhancements across a number of the components, standardized risk assessment and safety assessment tools, victim support, safety planning, offender accountability. I've shared probably a lot of this, but also public awareness and education. And just from the initial look that we've done at our office, there seems to be a really big gap. So there's work being done around the Be More Than a Bystander, there's work being done in the community level. But in British Columbia, how do we envision a public awareness and public education? And that's critical because then we have to look at prevention. What does prevention look like? Because our overall goal and our outcome is looking at preventing domestic violence, obviously. So we need to ensure that you, in your professions, as students, your various sectors, your family doctor, your neighbor, that we all have an understanding that, domestic violence is everybody's responsibility and it's not acceptable. And so how do we get that type of information and that type of public awareness? I know this is a big conversation we have at our office and with our stakeholders all of the time. And I know we can give countless examples of when we're sitting on the bus or we're on the SkyTrain or we're watching TV where we see various advertisements for various groups and we're holding our flag going, what about domestic violence? What about intimate partner violence? How do we make that a public issue? And it's everybody's issue. And I know at times folks have said to me, well, it's really a woman's issue. And I'm like, no, it's everyone's issue. It's a man's issue, it's a woman's issue, it's a professional issue. So it's something that we all need to work together to address. Just a quick slide, more for reference, but there are provinces that have domestic violence action plans going back many, many years. I've just gone to Prince Edward Island in 2001. The plan that I've spent a lot of time analyzing and working with experts on in Ontario is the Ontario plan that came out in 2005. And just at the end there, you'll see Manitoba is currently working on a domestic violence plan at this time as well. And they're going through a public consultation process. But if you're interested, you can look up any of those provinces and you'll be able to look at their plans. So part of developing our plan is how do we go about developing our plan and our community engagement. So I'm just going to stop right here for a second and let Sobhana come up for a couple of minutes. Sobhana, you have a couple minutes and then we'll finish off here and talk to you about the community engagement because it is critical to the development of the plan and how your voices can be heard as we develop the plan.
Thank you, Cory. Hello, everyone. I'm Sobhana. It's great to be here this afternoon. Can you hear me at the back? Okay, great. So my role in the Provincial Office of Domestic Violence is to, as the Director of Engagement and Partnerships, is to try and get out there and be receptive and open and respectful of the multiple perspectives and ideas and strategies and viewpoints that's there when it comes to domestic violence. Having been born in one country, raised in another, educated in another, and then immigrated to another, I can tell you that my definition and my opinion of a particular issue, whether it is child abuse or whether it's domestic violence, has changed dramatically over the years. And then within my own four walls of my home, if you talk to my children who are born in Canada and see themselves as Canadians, they have a completely different perspective. So I'm just looking around this room and I was thinking, if we had the time, I would give each of you a post-it note and say, what really is domestic violence and how can we address it? We get over 150 perspectives and views. So how do you then, as a representative of government and a government entity, come up with a provincial plan in which each of us can see ourselves, can see our families, can see our communities? Because there's no right and wrong, right? It's a democracy, it's a free country, and whether we're religious or atheist or however we want to live our civic lives, as long as we're not, violating the laws of the land, it's pretty okay. So how do we then, in this big provincial plan, engage with broad cross-sections of people and make sure that everyone's voice is sort of resonated in the plan? So that's my job, along with Cory and our little team, to get out there and talk to our partners, especially the community sector, and to try and understand where people are coming from. Whether it's a feminist perspective, or it's a faith perspective, an academic, or a legal perspective, they're all equally important and valid. So can we then say, okay, we've heard all these multiple viewpoints, it's a very loaded subject. Irrespective of how professional and objective we try to be, our emotions get triggered when we listen to a case, when we listen to a verdict in a court, when we hear a child testify about what the effect of violence is in their life, when we listen to a woman say, do everything you can to keep this person behind bars, and hear another woman from the exact same culture and socioeconomic background say, do everything you can to get my man back home, but just change his behavior, right? So how do we embrace it all? So it's not an easy job, but it's a very, very important job that needs to be done. And young children, youth, men, women, professionals are all suddenly wanting to be very, very vocal about saying domestic violence is an absolute no-no. And it's definitely not a private matter. So over the next few months, what Cory and I and the rest of our team are hoping to do is to get out there and engage with as many community partners and groups that we can. Use face-to-face meetings, use technology, use some creative social media and open government websites to get to the most remote parts of our beautiful province and to the urban areas, and to hear what people have to say, whether one has gone through domestic violence, whether one knows that someone has gone through, or whether one has just helped a person. what has that experience taught us? And then to sort of build on it and be very realistic as to where the priorities lie. And stop being positional about this, but in a respectful way, get the key message out, which is domestic violence in BC must come to an end. It's not about reducing the incidents, it's not about understanding why people do this, but about bringing it to an end. So that's what we're hoping to do the next little while with all of you here in the room and out there in BC. And over the next few weeks and months, we hope to get out messages to you folks to try and get as many viewpoints we can to incorporate into the plan. So look forward to hearing from you. Thank you.
And just to wrap it up, if we go to the last slide, we started engaging. Our goal is to have the plan ready for the spring. We're looking at May, June 2013, so not a lot of time. There will be opportunities to engage with us, and we'll leave you with, we have a one-page handout that we'll leave you with our email address, as well as our phone number and how to contact us. But we look forward to hearing from you, and I encourage you to take the message back to your communities, let them know about our office, and that we do want to hear from everybody. So thank you. Not sure if you can get up for a quick break because I know it's 1 o'clock, but appreciate your time over lunch. Thank you.
You guys all heard the provincial plan now from Cory, and the reason Cory and I communicated early when she first took office was the mission, mandate, purpose we have for Nevr is so similar to the office, the provincial office of domestic violence. So we thought, okay, we've started, we're running on the ground, we need to connect with the people who are going to have the legal authority to take this issue on. So that's why we've been working closely with the office to make sure that we are coordinated. Because that's one of the things you all told us in future sessions is we need to know what each other is doing. We need to hear the multiple perspectives. So it's so nice to hear Sobhana saying this is what we have to do, because that's what we've been saying. And that's why our research is focused on getting everybody's perspective so we can have good data to help shape this business plan. So thank you very much for sharing with us. Do we have any questions?